New tonight, different parts of the country are seeing an earlier and faster spread of the flu this year, with upticks in the south and on the East Coast. Health officials in Michigan are concerned about what could happen here. 13 on your side's Andrea Flores is here now with what they say could be behind the rise. Andrea.
Juliet, while not much flu activity has been reported in Michigan right now, health officials are encouraging everyone to protect themselves through vaccination and basic measures like hand washing, cough covering, and staying home when sick.
October is the best time to be getting a flu shot.
At Hometown Pharmacy in Kent City, they're doing about 20 flu shots per scheduled day. Pharmacy manager Rick Grice says that's a bit different than what he's seen in recent flu seasons.
People have been, over the past few years, been focused on COVID shots versus flu. So I would say it's consistent with pre-COVID numbers.
It's impossible to predict year to year what the flu season is going to be like.
Dr. Thomas Vaverka with the Michigan State Medical Society says there are several indicators pointing to a potentially more severe season, like an increase in cases and death in the Southern Hemisphere during their flu season.
It was felt likely due to the fact that we were taking a lot of precautions for COVID, wearing masks, socially distancing, and not traveling as much. So this protected us from influenza.
This means that people did not develop a natural immunity to the flu in the last 2 years, which Dr. Vaverka says is particularly dangerous for the elderly and young children.
They have not developed any natural immunity to influenza since they've not been exposed at all.
I'll be curious to see how that goes this winter, to see if, for the last couple of winters, we have primarily been wearing masks.
Health Services Director Kim Barron with Grand Rapids Public Schools says the district hasn't seen flu activity yet. The district encourages families to talk with their doctor about getting the flu shot and keeping their kids at home when sick.
A lot of the symptoms that we would ask people to keep their children home for are symptoms that you would see with a lot of communicable diseases and viruses. Fever greater than 100.4, cough, runny nose, headache, shortness of breath, extremely fatigued, things like that.
The Michigan State Medical Society says another indicator of a more active flu season is the increase of travel, which means more exposure. Juliet?
Andrea, thank you.